Lactate levels explained. It's time for an NCLEX trap. Your septic patient has a lactic acid of lactate is 5.0 even though you've started the sepsis protocol and blood cultures are in the lab, the first doses of antibiotics have been given, and you are actively resuscitating them with fluid. No pressors yet. Why is the lactic acid so high? Nurse assumes it just reflects infection severity. A lot of nurses might say the lactic acid is because the patient has a really bad infection, and you'd be right, partially. Lactic acid is elevated in sepsis and severe infections. But why? Elevated lactate signals tissue hypoxia and anaerobic metabolism. The patient's cells are starved for oxygen, are fueling themselves without oxygen. Lactate is a perfusion marker. In your patient, the lactate stays high, indicating that perfusion continues to be an issue. If tissue perfusion had improved, then the lactate would decrease. A decreasing lactate after treatment suggests improved tissue oxygen delivery. But don't treat the lab alone. First, reassess hemodynamics, oxygenation, and infection source control. The lactate trend matters as much as the actual number. If 5 is a decrease, you're on the right path. If it's steady or elevated, then it's time to assess and escalate. Always interpret lactate in context of perfusion and organ function. Yes, you can. Subscribe and study with us.